Minister for Health Philip Telesford is encouraging citizens who are affected by the gastroenteritis to utilize the various health centers spread across the country.
But the ministry, we have done and continue to do all in our power to try to educate people on one hand and on the other, try to respond to those who are ill and who have fallen ill as a result of this outbreak. Because we cannot continue to overburden the general hospital, but the local health centers and medical stations are fully equipped and competent enough to respond to things like gastro. And so we want to encourage our people to utilize the local facilities in your community. We have 36 of them spread throughout the length and breadth of Grenada. Please try and utilize them. Your problem will be solved. The doctors and nurses who are there, they're fully equipped, able and ready to respond to this outbreak.
During the past week, the Trinidad-based Caribbean Public Health Agency, CARPHA, identified sapovirus, salmonella and E. coli as the causes of the gastroenteritis outbreak in Grenada. Gastroenteritis is described as an acute or sudden onset of diarrhea with or, in some cases, without fever. A person with gastro will experience 3 or more loose or watery stools in a 24-hour period, with or without dehydration, vomiting and or visible blood. There is no specific treatment or vaccine for sapovirus. The illness subsides on its own within 1 week. The primary mode of transmission of the sapovirus is through the fecal oral route. Sapovirus can be transmitted by food or water contaminated with the virus or by contact with contaminated objects. It can be spread through unhealthy hygienic practices, such as not washing hands after using the toilet or after changing the diapers of babies and the elderly. E. coli and salmonella are both bacteria that can cause food poisoning. E. coli is spread through infected animals or people, whereas salmonella occurs in raw poultry, egg, beef, and occasionally unwashed fruits and vegetables. Minister Telesford reiterated the hygienic practices citizens should engage in.
These cycles happen from time to time, but we cannot let down our guard. And we had a very long dry spell in Grenada, and I believe all that gave impetus to the spread of the disease. So I think what we need to do now is to be very careful. And this one was very bad this time around. I mean, quite a lot of people cried out about this. What we want to do is to continue to encourage people to sanitize, boil the water, ensure that the utensils are clean, ensure that the children, their hands are clean. Those who suck fingers, we have that still. Ensure that those hands are clean and the children do not put their hands in the mouth. Just like that, the bottle, those who use bottles and so on, ensure that it's clean and try as much as possible to use cups as opposed to just using bottles to put into their mouths. But generally, we have to be much more conscious of what is happening around us and to try to avoid contamination at all costs.
Christina John, GBN News.